I'm Jason Antus with Sanford Health News, and representatives from Sanford Health are taking part in the American Hospital Association's annual Rural Healthcare Leadership Conference. We're joined now by Natasha Smith, Sanford Health's Head of Diversity, Equity, and Inclusion, who just got done speaking on a panel. Natasha, thank you for joining us from Orlando, where more than 1,000 rural health leaders have gathered to share actionable strategies to advance rural healthcare. Can you tell us a little bit about what you're hearing down there from other rural healthcare leaders in terms of the importance of health equity?
Well, thanks, Jason, for taking some time. Really exciting stuff already this morning. We're only half the day in, and this morning we had the opportunity to kick off with Dr. Gita Noir, who spoke a little bit about the challenges, that exist for rural communities and really how healthcare systems in rural spaces are uniquely positioned to address some of them. I think one of the things that she said that really stuck with me from a health equity perspective is just this notion or the sentiment that she has heard in her community around patients wanting care from people who look like them, who share similar lived experiences and really have that shared identity. And, really from a workforce perspective, the opportunities that exist for healthcare systems, particularly those in rural areas, the opportunities that we have to increase that representation, to really build cultural competency and improved employee experience. Because ultimately, we know at the end of the day, all of that really impacts healthcare outcomes.
Now, the healthcare industry is currently facing a number of headwinds and macroeconomic pressures. How has Sanford Health strengthened our health equity and DE&I work, even amidst these challenges? And do you have advice to other health systems who might be at risk of budget cuts in those areas?
Absolutely. This is a topic that has been heavily discussed today. I think, in terms of sustaining or sustainable health equity and diversity, equity, and inclusion strategy, it's super important that we're thinking about how do we influence different bodies of work rather than trying to create one new standalone body of work or strategy. This work really it comes to life and it's sustainable when we're able to build it in across an organization. I think in terms of our organization, we've done a phenomenal job in doing just that, not building this into one department, one area, but really influencing the various areas of operations in our different regions, really building something sustainable, both from the ground up, but also from the top down, creating shared language, championing education where folks really understand the different lived experiences and the health disparities that do exist in our communities, and using that knowledge as power, as we think about executing on our mission as an organization.
Can you talk a little bit about an innovative approach or an initiative that Sanford Health is prioritizing right now that makes you the most excited about expanding equitable health outcomes in the communities that we serve?
Absolutely. I think there's a lot to be excited about. We've got a lot in the rear view mirror, too. We've got a lot behind us, but a lot more ahead of us, right? Something that I'm really excited about in the coming year is that we are actually going to embark on the process of leveraging the American Hospital Association Health Equity Transformation Assessment, which is a fantastic tool, I think, to really create a baseline, really measure where are we at today and what does tomorrow look like. Creating that benchmark is really important for a lot of reasons. I think there's some accountability in benchmarking, but it's also a tool that we can use to celebrate our successes. I think historically we've done this work. We've put our head down and got to work on equity strategy because it's the right thing to do. But also, we should have those opportunities to really celebrate where we're advancing, to have a pulse check on maybe where we're not. So we have a good sense of, where this work is at. I also really like that tool because it is a comprehensive approach to health equity strategy. It's our quality and safety, it's our education, it's our workforce and recruitment strategies, it's our data and how we look at our data, how we serve our data up for leaders from a strategic planning perspective and a measurement perspective. So it's really bringing all of that work together under one umbrella, which I think is critical, to ensuring that we're advancing health equity and equitable and inclusive workplaces from a comprehensive place, but also where we're building in some sustainability.
And lastly, I know it's early in the week and it's early in the conference, but are there any ideas or programs that you've heard about in your short time there already that's intriguing to you? And what do you expect to bring back as a key takeaway?
That's a great question. I've heard a couple of things. One kind of resounding message right now is, be aware of our legislative environment. Talk to your lawmakers, make sure that we're helping to influence, the voice of the healthcare industry and the healthcare provider, those that are at the bedside, ensuring that those that are making decisions are doing it from a really informed place, which I thought was an exciting position, to hear about today as we think about how to influence. And then another one, getting to partner on this panel discussion with another hospital system and hearing about the ways that they're lowering the barrier of entry to education. They're taking into consideration spirituality and religious affiliation, how that impacts the sentiment or the trust that might exist in certain populations, looking at educational requirements for different roles, criminal background even for certain roles, thinking about second chances and really reintegrating folks into the community with really well-rounded employment opportunities, etc. When you think about what we've heard today, it's really it spans a football field worth of sentiment, but it's been really great.
Thank you, Natasha Smith. That is Sanford Health's Head of Diversity, Equity, and Inclusion. Natasha, thanks so much for joining us today from Orlando. For Sanford Health News, I'm Jason Anschutz.